Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Xarelto, Rivaroxaban. Introduction. Blood clots are frequent in patients who have diseases of the blood vessels or heart. Blood clots may pose a dangerous threat to some people, as they may cause loss of a limb, strokes, and even death. Your healthcare provider may ask you to take a blood thinner called Xarelto or Rivaroxaban to help prevent harmful blood clots. Xarelto is a blood-thinning medication used to reduce the risk of stroke and blood clots in people with atrial fibrillation that is not caused by a heart valve problem. Unlike other common blood-thinning medications, such as Coumadin, also known as warfarin, Xarelto does not require frequent blood tests to monitor how thin the blood is. This program will help you understand better the benefits and risks of Xarelto. Benefits of Xarelto. Blood contains natural substances that cause it to clot. When a person bleeds as a result of an injury, the natural clotting substances in the blood cause the blood at the injury site to harden and form a seal. These clots help minimize blood loss from the injury site. Some patients with diseases of the blood vessels and heart, or who are limited in their mobility following surgery, can form harmful blood clots inside the blood vessels. A harmful clot is called a thrombus. These clots can get bigger and block the flow of blood within blood vessels. The clots can also move within the body. Body parts that stop receiving blood because of a thrombus can be damaged considerably. A stroke results when a thrombus stops blood flow to part of the brain. A heart attack results when a thrombus stops blood flow to the heart. When a thrombus stops blood flow to part of the leg, gangrene may happen. Gangrene is the death of tissues in your body. It requires amputation of the affected area. A pulmonary embolism happens when a thrombus stops blood flow to the lungs. This may lead to shortness of breath and the possibility of death. All people are at some risk of forming harmful blood clots, but some people are at higher risk, including patients that are on bed rest, that have implanted medical devices, with cardiovascular diseases, with irregular heartbeat. To reduce the risk of harmful blood clots, healthcare providers may ask patients to take a medicine called a blood thinner. Xarelto is a blood-thinning medication your healthcare provider may prescribe. It is especially useful for treating a type of blood clot known as deep vein thrombosis. Xarelto decreases the body's ability to form clots. This makes it less likely that harmful blood clots will form inside the heart and blood vessels or around implanted devices such as mechanical valves. Other blood-thinning medications like warfarin are affected by interactions with many common foods and with other drugs. Patients have to monitor the quantity and frequency of green leaves and vegetables they eat. As a result, frequent blood tests are needed to find out how thin the blood is and adjust dosage. Your healthcare provider will tell you for how long you will have to take Xarelto. Some patients may have to take Xarelto for the rest of their lives. Risks of Xarelto. Like any other medicine, Xarelto poses some risks which you should know about. By understanding how these risks arise, you will be able to avoid them or detect them early if they happen. People who are allergic to Xarelto should not use it. Signs of an allergic reaction include hives, difficulty breathing, swelling of the face, lips, tongue, or throat. Immediately contact a healthcare provider if you experience an allergic reaction. People who have active or uncontrolled bleeding should also avoid using Xarelto. There are some side effects associated with Xarelto. Some of the side effects are severe, even life-threatening. Others are less serious but irritating. Less serious side effects of Xarelto include itching, Muscle pain, pain in your legs or arms. A more serious side effect of Xarelto is related to your spinal health. Xarelto may cause a serious blood clot around your brain or spinal cord if you undergo a spinal tap or receive spinal anesthesia, also known as an epidural. Other risks associated with Xarelto relate to uncontrollable bleeding. Because Xarelto reduces the body's ability to form blood clots, a patient on Xarelto will bleed longer after an injury than a patient who is not on Xarelto. Longer bleeding can result in an excessive loss of blood if the person is involved in an accident. Severe blood loss can be fatal. Faster, longer bleeding also poses a potential risk when bleeding happens inside the body. For example, if there is bleeding in the stomach caused by an ulcer, the body cannot easily stop this bleeding. This can cause dangerous situations that may be fatal. Bleeding inside the brain, even after minor accidents, can also be deadly. People with the following health conditions may bleed more easily while taking Xarelto. A bleeding disorder caused by another disease. An inherited bleeding disorder. Hemorrhagic stroke. Stomach or intestinal bleeding or ulcer. Uncontrolled high blood pressure. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Taking Xarelto. Xarelto comes in a capsule or pill form. Xarelto is a once-daily medication. This means that you take it once a day, every day. It is recommended for patients who take Xarelto to take the pill at the same time of the day, every day. Never crush, break, chew, or open a Xarelto capsule. The pill should be swallowed whole. Xarelto capsules should be stored at room temperature, away from heat and moisture. Unlike some blood-thinning medications, there is no need for routine blood monitoring while taking Xarelto unless requested by your healthcare provider. There are no dietary restrictions associated with Xarelto unless otherwise suggested by your healthcare provider. Never adjust your dosage without your healthcare provider's approval. Also, you should never start or stop a medication without first talking to your healthcare provider. Xarelto works best when it is taken regularly. Try not to miss any doses of Xarelto. Doing so increases your risk for blood clots, stroke, and other health problems. If you miss a dose of Xarelto, take the missed dose as soon as you remember. Take your next dose the following day. Never take 2 doses of Xarelto on the same day. It is important to tell a healthcare provider that you take Xarelto before receiving surgery, dental work, or any type of medical test or treatment. You may need to stop using the medicine for a short time. Special considerations. While taking Xarelto, you should avoid activities that may increase your risk of bleeding or injury. Take special care when shaving, brushing your teeth, or performing other daily tasks that may cause bleeding. You should also avoid drinking alcohol while you are taking Xarelto. Drinking alcohol while taking Xarelto may increase your risk of bleeding in your stomach and intestines. If you decide to drink alcohol with your healthcare provider's approval, drink a moderate amount and the same amount of alcohol every day. Patients on Xarelto should ask their healthcare provider or pharmacist before starting any new medications, especially antibiotics and even over-the-counter medications and supplements. This is important because there are many medications and supplements that can affect Xarelto. Non-steroidal anti-inflammatory drugs like Advil also affect blood clotting and should not be used with Xarelto without the approval of a healthcare provider. Your healthcare provider can weigh the benefits and risks and determine whether to make an exception. Make sure to tell all healthcare providers that you are on Xarelto, especially if any type of surgery or injection is considered. Women who are pregnant or planning on becoming pregnant should talk to their healthcare provider about using Xarelto. A healthcare provider can discuss any risks of miscarriage, breast milk toxicity, or infertility associated with Xarelto. At this time, no such risks are known. It is recommended that patients who are on blood thinners like Xarelto wear a medical alert bracelet. This is especially important in cases of medical emergencies when you are unable to communicate with your healthcare providers. When to call your healthcare provider. Even if you are taking the prescribed amount of Xarelto, dangerous internal bleeding or blood clots can still happen. It is important to report any signs of internal bleeding or blood clots to your healthcare provider. You should seek immediate medical attention if you have a serious fall or hit your head, especially if you develop a headache or if you become sleepy or weak. A healthcare provider may want to check that you do not have bleeding within the brain. If you notice any blood in your urine or stools, or if your urine or stool turns dark, call your healthcare provider. Your healthcare provider may want to check that you do not have internal bleeding in your digestive or urinary systems. If you notice unusual bruising, large areas of bruising, or black and blue marks on your skin for unknown reasons, seek medical attention. This may mean that you are bleeding under your skin. Small bruises that result from minor accidents such as a leg hitting the furniture are normal. They do not require an automatic call to your healthcare provider. Check with your healthcare provider if you experience dizziness, trouble breathing, or chest pain. Also seek help if you feel weak or more tired than usual, or if you feel like you might pass out. These can be the signs of blood loss and anemia. Contact your healthcare provider if you experience numbness, tingling, or weak muscles, especially if you experience loss of movement. Seek medical attention when there is bleeding from cuts or from your nose that does not stop after approximately 7 minutes. Call your healthcare provider if you notice more bleeding than usual when you brush or floss your teeth. Tell your healthcare provider if you notice more bleeding than usual when you get your menstrual period or bleeding between periods. If you have a high fever or an illness that seems to be getting worse, seek medical attention. You should also check with your healthcare provider if you notice any blood when you cough or vomit, which may look like coffee grounds. Also report any unusual bleeding from your vagina or rectum. If you experience pain or swelling in any of your joints, check with your healthcare provider. You could be bleeding inside the joint.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Your healthcare provider may ask you to take a blood thinner to help prevent harmful blood clots. Xarelto is a type of medication that is used to thin the blood and prevent clots. Xarelto decreases the body's ability to form clots. This makes it less likely that harmful blood clots will form inside the heart and blood vessels or around implanted devices such as mechanical valves. Xarelto comes in a capsule or pill form. It is taken once a day, every day. Your healthcare provider will help determine what dose of Xarelto you should receive. There are some side effects associated with Xarelto. Talk to your healthcare provider about the potential risks associated with Xarelto. While taking Xarelto, you should avoid activities that may increase your risk of bleeding or injury. Take special care when shaving, brushing your teeth, or performing other daily tasks that may cause bleeding. You should also avoid drinking alcohol while you are taking Xarelto. Drinking alcohol while taking Xarelto may increase your risk of bleeding in your stomach and intestines. Your healthcare provider will tell you for how long you will have to take Xarelto. Some patients may have to take Xarelto for the rest of their lives.
Thank you for using Explain.